The effects of caffeine on your mental health. Are you a big fan of coffee? Or do you drink coffee so often like you feel addicted to it? You feel that you lose your mood if you don't drink coffee while working. There are many times in your life that you will feel very weak when you don't find coffee in the morning. Be careful, because it turns out that researchers have found some of the negative effects of coffee on health. Coffee can even be bad for mental health. If you are a big fan of coffee, watch this video until end. Then you will know the shocking effects of caffeine for your mental health. Before figuring out the bad effects of caffeine on mental health, let's check several facts regarding caffeine and coffee. Caffeine does not only found in coffee, but also in other kinds of foods and beverages like tea, cola, and chocolate. So when you think that, I'm not a coffee drinker, so this video is not for me, you are totally wrong. If you consume foods with caffeine as your regular basis, even though it's not coffee, you need to be aware of the effects of caffeine on those foods. Caffeine consumption is so common these days. Also, when it comes to having a cup of tea or coffee, most of us don't think twice. We only know that coffee is not good to drink before bed. But in fact, caffeine contained in tea and coffee alters brain functioning, with the potential to affect mood or cognition. When it comes to caffeine, note that each individual will be affected differently, according to each condition. So if you decide to be a coffee drinker or tea drinker, know yourself whether those beverages can trigger your mental health or not. Be a healthy caffeine consumer by limiting consumption of foods and drinks that contain caffeine. Here are the effects of caffeine for mental health that may occur to you if you're not wise consuming caffeine. 1. Mood disorders. The excessive caffeine consumption will trigger mood disorders such as anxiety, depression, irritability, and attention disorder problems. Excess caffeine will not increase mental activity as coffee addicts believe, but will reduce blood flow to the brain by as much as 30% and have a negative impact on one's memory and mental performance. Mental illness can occur after the stimulant effects of coffee wear off. Usually, it's around 3 hours later and also during the recovery period after discontinuing caffeine consumption, especially if you consume caffeine as regular basis. 2. Increasing stress. The reason caffeine is dangerous for mental health is because it triggers the release of stress hormones, namely the hormone cortisol from the adrenal glands. As the result, it can increase the level of anxiety, irritability, muscle tension, digestive problems, insomnia, and even decreased immunity. Keep in mind as well that continuous stimulation of the adrenal glands can cause fatigue in these glands so that a person becomes susceptible to disease disorders such as autoimmune or inflammation. A drastic increase in stress hormones can also cause a person to be unable to make a logical response to certain stressful situations in everyday life. 3. Stimulating anxiety. For someone with anxiety, it's a bad news that caffeine is a stimulant for anxiety. It will make your anxiety even worse. The effects of caffeine on the body will be similar to the effects when our body experiences a frightening situation. This happens because caffeine triggers a fight or flight response in a person's body. Research shows that this response can exacerbate anxiety and trigger anxiety attacks. And along with these symptoms of anxiety, consuming too much caffeine can make you more nervous, moody, and awake all night. 4. Causes difficulty of sleeping. Sleeping in good quality and quantity is very essential for our health, body physically and mentally. But caffeine can make falling asleep and staying asleep more difficult. Lack of sleep can cause depression and other mental illness. If you have trouble with sleeping, don't drink caffeinated drinks or foods at the end of the day. Some people need to limit their intake of caffeine in the morning. Some of them even give up caffeinated drinks completely to avoid sleeping problems and triggering the anxiety problems that often accompany depression. 5. Drop your mood. Some people believe that coffee and other caffeinated drinks can increase good mood. So they consume coffee excessively to be more productive and ready to fight the hectic days. But do you know that if you regularly consume caffeinated drinks, stopping them can lead to a depressed mood until your body adjusts? Research has found that quitting caffeine can lead to a depressive mood until the body adjusts. In addition, various symptoms can also appear, such as headaches, fatigue, and irritability. Rather than consuming caffeinated drinks excessively to cure depression or to increase mood, find out how to deal with those mental illness through therapy or counseling. 6. Causing panic attacks. Caffeine achieves its effect by blocking the activity of adenosine, a neurotransmitter that makes us sleepy and tired. By boosting the brain chemicals dopamine and acetylcholine, caffeine provides the desired feelings of increased motivation, productivity, and brain power. But for those with anxiety, it will have the opposite effect. The reason caffeine is dangerous for other mental health is that it can inhibit the formation of the neurotransmitter GABA, which can calm the mind. GABA stops brain activity when needed and is often thought of as natural Valium. Low GABA levels are associated with anxiety and panic attacks. Likewise with the depletion of serotonin that can occur if consuming caffeine regularly. 7. Causing insomnia. One of the effects of caffeine consumption is insomnia. It's a common effect of caffeine most people know, but not everybody aware why it's so dangerous. Difficulty sleeping due to caffeine is a common psychiatric disorder. If restless thoughts keep you awake at night, caffeine can exacerbate that condition. Caffeine can lower the level of deep sleep and decrease the quality of sleeping. Figure out the psychological causes of insomnia and how to deal with the side effects of depression medications. 8. Causes at least 4 mental illnesses. The Diagnostic and Statistical Manual of Mental Disorders 5, DSM-5, is the American Psychiatric Association's standard guide for mental disorders. The DSM-5 lists 4 mental disorders linked with caffeine, namely caffeine intoxication, caffeine-induced anxiety disorder, caffeine-induced sleep disorder, and caffeine withdrawal. WHO and various other health practitioners state that caffeine addiction is a clinical disorder. So you need to be aware when consuming caffeine, know your limit so you will not consume caffeine excessively. After knowing several bad effects of caffeine on your mental health, should you stop consuming coffee? In certain cases, for example, if you have problems with anxiety or sleeping disorders, you should stop consuming coffee, do it slowly. But if you don't have certain health problems, limit your consumption of caffeine every day to avoid bad effects. Drinking coffee should not be more than 4 cups per day, or contain about 400 milligrams of caffeine. However, if you also like chocolate or cola, drinking 1 or 2 cups of coffee per day is enough.